Let's chat about virtual physical therapy. Depending on where you are in the world right now, virtual is a fantastic option. And I said this when COVID started, and I will say it again. Like, I don't see virtual diminishing, I see it growing. And I was actually doing virtual telehealth PT before COVID. I think as a provider, it's made me a better PT. And quite honestly, I think for clients, you actually get a better session because your PT, your doctor, whoever you are, they see you in your own environment. It's not, this setting up this perfect scenario. Like, they see the chaos. They see the equipment that you have. You use what you have. I'll just give you a little context of what kind of my experience has been. So I was telehealth for probably the first 4 or 5 months of COVID. So whatever year that was, because I don't know what year it is now. And things kind of went back to a little bit more in person. But now, I mean, gosh, with people, coming back from the holidays, we had a lot of snow here last week, people testing positive. It's very easy for me to, if somebody emails me and says, hey, I don't have childcare or I've got COVID, I'm fine, but I can't come in, we just change the appointment type. And from a provider standpoint, I have to be really good at asking the right questions. I have to be really good at listening. I have to be really good at taking in the entire picture because my hands can't do that for me. And so I think, one of the best skills we can have as a provider is listening, because I swear to God, 99.44% of my clients have the answer to what's going on with them. My job, I feel like, is just kind of making sense of it all, laying it all out, trying to, it's almost like a puzzle. Is you have all the pieces or most of the pieces, and then you got to figure out which one's dropped on the floor. But your job is to kind of put this whole big picture together. I had a great session with a client last week who has a home gym, and we literally, and she's not planning on going out for a little bit. She has kids that are not vaccinated, and she's feeling nervous about it. And so we literally, said, okay, do you have this? Do you have this? Let's set it up. And I have gotten to be a very good film director and getting the right screenshot. I've even diagnosed some pelvic organ prolapse with some very creative camera work and lighting. It's all about the lighting. So, I mean, I think it's one of those things that as the world gets smaller and we just have the ability to access whoever we want, whenever we want. And so having the ability to talk with a provider, if let's say you live in the middle of nowhere and you've got an internet connection, but no pelvic floor PT that's within driving distance, or you don't have childcare to be able to go. I truly believe that telehealth can give us so many options. Same thing if you're a coach or a trainer. Because again, there's so much that you can screen visually and questions that you can ask, kind of put that whole picture together. I also feel incredibly strongly about this because I grew up in a pretty rural area in Western New York, and to go to the, not the podunk local hospital, but like the legitimate hospital was 70 miles. And granted, when I lived there, I guess we just started to get internet yet. We didn't have cable. That's what it was. If you had an internet connection, gosh, you just have so much more access. And, one of the tough things I hear, people DM me and they say, oh, well, there's no PT nearby me. What do I do? And I just wish there were more telehealth options open for people. There's been such great strides in getting, for licensure, as far as, for example, like, I'm licensed in DC, Maryland, Virginia, West Virginia, because those states are driving distance to here. And, if people commute here, then they could possibly, want to see me in person, and a telehealth option is great for them. So there's some great options as far as getting licensure. I can't think of the word right now, but like if you're in a partner state, you can get your license from a major state and then be able to get a license just because you apply and pay a fee. No, I think it's one of those things that if you are a mom and you're worried about going into a provider's office, see if they have telehealth options. There's so much that you can do. And if you're a provider, please consider providing telehealth options to your clients, because again, I don't think this is going away, and we need to improve convenience. We need to improve accessibility for moms for sure. When these things come up, when people don't have childcare and they're home on quarantine and everybody's fine, but they can't go anywhere, like we need to be better about making sure our moms have options, because Lord, we are tired. And if we keep putting it off, taking care of ourselves, it isn't going to be good. It's not going to be good. So if you have questions about telehealth, or as a mom, if you have questions about telehealth, if you're a provider and kind of how to do it, please hit me up in the DMs. But no, I've been a huge fan since before COVID. I'm going to keep doing it. I do it with some of my providers, and it's been fantastic. So anyway, huge fan. Stay safe. Provide your clients options. Just saying.